Welcome to This Explainer. We're on an absolute mission today to demystify headaches. Look, for so many of us, getting a headache is just, well, a completely normal, albeit super frustrating part of life. But when that throbbing pain hits, it's so easy to panic and think, wait, is this just stress, or is this something I should actually be worried about? Our goal today is to literally separate everyday pain from real danger, giving you a clear, patient-friendly roadmap so you know exactly what your body is trying to tell you.
It's the ultimate anxiety-inducing question, right? Like, when is a headache actually dangerous? The hugely reassuring truth here is that pretty much everyone gets a headache at some point, and the vast majority of them are entirely harmless. No big deal. But there's a very small minority that act as warning signs for something much more serious. We're talking bleeds, infections, or even raised pressure inside the skull. So knowing how to spot the difference, that is incredibly empowering for you as a patient.
Now, before we really get into the weeds, just a quick but super important heads up. The information we're covering today is a guide to help you understand different patterns of head pain. It's educational content meant to make you a more informed, confident patient. But, and this is a big but, it is absolutely never a substitute for a proper clinical assessment. You should always seek out a doctor to evaluate your specific situation. So, here's our roadmap for the explainer today. We're going to look at primary versus secondary headaches, cover the big warning signs and red flags, break down the 3 most common everyday headaches, uncover a completely hidden painkiller trap you need to know about, and finally, pinpoint exactly when and how you should seek help. Let's get right to it. All right, starting off with Section 1, primary versus secondary headaches. This is the key distinction, so let's dive right into this one. This breakdown right here illustrates basically the most fundamental medical concept when it comes to diagnosing head pain. It's like a giant sorting hat. As you can see, we split this into 2 broad groups. On the left, we've got the primary headache. This means the headache itself literally is the condition. There's no sneaky underlying structural cause behind the pain. Migraines, they live right here. But then on the right, we have the secondary headache. In this scenario, the headache is just a symptom of something else going on in your body, like an infection, a bleed, or a tumor. So the whole secret to a good headache assessment is actively trying to rule out those scary secondary causes first. Once we know those are off the table, we can safely reassure you about a primary headache.
Moving on to Section 2, let's talk about warning signs and red flags, and exactly when you need to start thinking about those secondary headaches.
Okay, so the very first major red flag you absolutely need to know about is what doctors call a thunderclap headache. And listen, this isn't just your run-of-the-mill, really bad headache that slowly ruins your afternoon. No way. A thunderclap headache is severe pain that hits its absolute worst ever intensity within seconds to minutes. It literally hits like a lightning strike. This is a massive red flag because it forces clinicians to immediately look for sudden, dangerous issues, like a sudden brain bleed, until proven otherwise.
Now, beyond the thunderclap, there are a few other highly specific physical clues that should immediately prompt an urgent assessment. What's really interesting about this is how these physical clues tell a story. For example, if your headache gets way worse when you lie down, wake up, cough, or strain, well, that can be a sign of raised pressure inside your skull. If you've got a fever and a stiff neck tagging along with your headache, that points straight toward an infection like meningitis. Other big red flags to watch out for include any totally new physical symptoms like unexplained weakness or vision loss. Also, getting a brand new headache if you're over 50, having a history of cancer, being pregnant or postpartum, recent head trauma, or even just a suddenly changing pattern in a headache you've had for years. Basically, any single one of these clues takes us completely out of reassure and manage territory. It means the headache is acting as a blaring warning alarm for a different emergency.
All right, on to Section 3, the 3 common primary headaches, otherwise known as our everyday culprits. But hey, let's take a collective breath here. Because once your doctor screens for and rules out all those red flags we just talked about, the vast majority of headaches fall into one of 3 totally benign, highly manageable categories. Let's just walk through a really simple mental flowchart together so you can match up your own symptoms without getting bogged down in medical jargon. First up, migraines. The pain here is usually pulsating or throbbing, typically stuck on one side of your head, and it definitely gets worse if you try to do routine physical activity. It also brings along some awful friends nobody invited: nausea, vomiting, and a serious sensitivity to light or sound. Next, we've got the tension-type headache. This is your classic tight band around the head feeling. The pain is pressing or tightening on both sides. It's usually mild to moderate, doesn't get worse when you move around, and crucially, it distinctly lacks that severe nausea you see with migraines. Finally, cluster headaches. These are severe and very strictly located around one eye or temple. They come in intense bouts, multiple short attacks over weeks, and they come with highly specific physical signs on the exact same side as the pain, like a watery or red eye, nasal congestion, or even a droopy eyelid. Also, people dealing with cluster headaches are often restless or pacing around during an attack, which is totally unlike migraine sufferers who usually just want to lie perfectly still in a dark, quiet room.
That brings us to Section 4, the hidden painkiller trap, or medication overuse headache. Let's see how this builds into something that honestly catches a lot of patients and clinicians by surprise. Yes, the number 15 is absolutely crucial here. Believe it or not, one of the most commonly misdiagnoses out there is a headache that is actually being driven by the exact same treatment you're using to try and stop it. Think about that for a second. If you're taking simple everyday painkillers like paracetamol or NSAIDs like ibuprofen for 15 or more days a month for 3 months or more, that medication itself might literally be causing your headaches.
And it gets crazier because that threshold drops even lower depending on what you're actually taking. If you're using stronger medications like triptans, opioids, or combination painkillers, taking them on just 10 or more days a month is completely enough to trigger this exact same hidden trap.
So what on earth do you do if you find yourself caught in this vicious cycle? Well, the highly counterintuitive part is that the only real cure is withdrawal from the overused medication. And I'm not going to lie to you, you have to be prepared. The headaches almost always get worse before they start to get better. It's a really tough hurdle for sure, but it is literally the only way out of the trap. It's also super important to note here that if you have a confirmed primary headache and you don't have any of those red flags we discussed, standard medical guidelines actually do not recommend getting brain scans just for peace of mind. The pattern itself and addressing things like medication overuse is the real key to finally getting your life back. Finally, we arrive at Section 5, when to seek help. This is your safety net. Let's bring everything we've talked about together into some crystal clear, actionable steps based entirely on your symptoms.
This is arguably the most vital takeaway of our entire explainer, because it directly empowers you as a patient to make the right, safe choice for yourself. Look on the left, we need to call 999 or go to A&E immediately if you or someone you're with experiences that sudden, worst-ever thunderclap pain, or if a headache is paired with a fever and neck stiffness, or any brand new weakness, confusion, or vision loss. Those are the screaming red flags demanding urgent, right-now action. Now look on the right. If you have a new headache or your usual headache pattern has changed or progressively gotten worse over days or weeks, but you do not have those immediate emergency features, the absolute right move is to book an assessment with your GP rather than just passively waiting it out.
Remember, most headaches are primary, benign, and totally manageable, but it's that systematic checking for those red flags that keeps us safe. So I'm going to leave you with this provocative thought to really reflect on. When it comes to your own headache routine, are you just passively treating the pain day after day? Or is it finally time to step back, speak to a clinician, and actually find the pattern? Thanks so much for joining me on this explainer, and as always, stay curious.